Welcome to the posture-based rehabilitation and exercise program. The first step is breath control. Breath control is really the tip of the spear in this program, and anyone who is rehabilitating any part of their body, eventually graduating to whole body exercise, and then ideally cardiovascular, would need to have this protocol in place before making that transition. Let's go through the steps of breath control. The first one is that we're always going to breathe through the nose. That includes inhale and exhale. The second step is to lead with the diaphragm, which means breathing with your abdomen, not your neck and upper chest. The third step is to control the exhale. That is to try to maintain a 2-to-1 ratio of time for exhale to time for inhale. And the last step is to create space between the breaths. Let's take a look at the form and see what it looks like on video. So the first step is, again, focusing on breathing in through the nose and, of course, also breathing in through the abdomen. Notice there's very little neck or chest movement. Even in the shoulders, we try to keep those down as we breathe through this system. And again, look at the timer. Breathing in through the nose, building up pressure in the belly before a pause, and then very slowly letting the air out all through the diaphragm and exhaling through the nose as well. The benefits of each are unique to the program. Inhaling through the nose is going to warm, filter, and accelerate the air through your body. Exhaling through the nose is going to have multiple benefits as well. We're slowing down breathing. We're going to allow more time for oxygen exchange in the alveoli, and you're also going to promote active breathing through the use of those abdominal and pelvic muscles. Now, controlling the exhale, we mentioned that a couple of times. That's one of the things that breathing out through the nose actually helps. The benefit, though, is that controlled exhale calms the nervous system. It also allows for more time for oxygen and carbon dioxide exchange, and again, promotes the use of those abdominal and pelvic muscles. And the last step, creating space between the breaths. This is going to help you maintain a sense of calm even during high performance exercise or stress. It will literally inhibit the sympathetic nervous system or your fight or flight response to stress. And it's going to serve as the final indication where if you lose the space between the breaths during exercise, you need to shift into a recovery mode, get your breath back, and then re-up your effort again. So in summary, your respiration is constant. You're going to use breath control pretty much any time or place. We get that question a lot. You can use this in the boardroom. You can use this when you're exercising. You can use this during the day to help you sleep at night. There are so many benefits. They're nearly endless. This method is really effective for all of those functions, but it does so by syncing up the brain, the heart, and the lungs when done correctly. So take your time to learn it. And lastly, the breath control can be used to optimize your health response to a wide variety of activities, including the most challenging in our series, high intensity interval training. So take your time, especially if you're in rehab, get this core piece of your posture down so it can help you with more advanced exercise and stress control later.